Hi there and welcome to this video about an AED. Now you might be thinking, what is an AED? Well, AED stands for Automated External Defibrillator. You might have heard it called many things, maybe a shocky thing, a defib. Just as long as everyone knows what you're asking for, when you go and ask them to call the ambulance, you're also asking for an AED as well. Now you might be thinking to yourself, where can I find an AED? Well, AEDs are cropping up in more and more places nowadays. Sometimes you might hear them referred to as PADs, Public Access Defibrillators, which means they're available to anyone to use on the outside of buildings at any time of the day. Sometimes though you might find they've got a lock and you have to phone 999 in order to get the PIN code in order to be able to release it. Or you might find them in easier accessible places such as in leisure centres or in schools, train station platforms, Waitrose, Sainsbury's, lots and lots of places have them nowadays. If you live in a rural area, you might also find them in a telephone box that has been designed just to hold AEDs. I want you to have a look around your local area and see if you can actually find an AED. Now the signage has recently changed. This is one sign and this is another sign that could be used to locate where your AEDs are. You've probably seen them before but not actually realised what they were. Or maybe you thought, I don't know how to use that. Please remember though, an AED is very easy to use. Anyone can use it. It talks to you. It tells you exactly what you need to do. Get it off the wall and get using it. Now, as you can see from the photos I'm showing you, there are lots of different makes and models of AEDs around. However, they've all got the same basic principles. They've all got an on and off button, and they've all got a shock button. They all have a set of pads. Now some of them will have pre-plugged pads and some of them you actually have to plug in yourself. All AEDs will also come with an accessory pack, and in that accessory pack you should find a towel, a pair of scissors and a razor. Now the scissors are used to cut the clothing, and when you're cutting the clothing off you've got to make sure you cut from the neck downwards. Now the pads are a bit like plasters. They have to be able to stick to the skin. So you'll get given a towel in your accessory kit. The towel is used to dry a patient, especially if they've been sweating or if they've suffered from a heart attack that's led into the cardiac arrest. They're going to be very clammy, so you need to be able to wipe them dry. There's also a razor included in that pack, and the razor is just to hack away and remove the hair so the pads can actually stick to a naked chest and not float on top of hairs. So now we know what an AED is, we know where we can find one, we know what one looks like, but now we need to know how to use it. Now this image is really important to understand. It is crucial you recognise when someone is in cardiac arrest and you call 999. It is crucial you start CPR, you ask for an AED, and you use the AED, and they get to hospital quickly. If you can do those 4 things as quick as possible, as soon as the person is in cardiac arrest, then the chances that person has of surviving and also their quality of life is greatly increased. Now we keep mentioning the word cardiac arrest, but what is it? What is a cardiac arrest? Well, a cardiac arrest is when the heart stops beating normally. It malfunctions. Now this is different to a heart attack because a heart attack the person can still be conscious, whereas a cardiac arrest the person is unconscious. A heart attack is a blockage, which means the heart can't pump effectively. You are still conscious if you're having a heart attack, whereas a cardiac arrest you are not conscious, you are not breathing. You need to be doing CPR to that casualty, you need to call the ambulance and you need to get an AED to them as quick as possible. Now please watch the next 2 videos. There's one about adult AEDs and another one about how to use an AED on a child and infant. Please remember, these AEDs are life-saving devices. They are not wall decorations. Therefore, if someone is in cardiac arrest, make sure you call the ambulance and go and get the nearest AED. Grab it from the wall, turn it on and follow the instructions. You do not need to be trained in order to use it. These are life-saving devices. Get it and use it. The quicker you can get an AED to a casualty in cardiac arrest, the greater the chances of survival are for that casualty, and also an increased quality of life.